Hello, hey everyone, welcome to Sleepy Radiology classes. And I promise it will be easy for you. Hello everyone, welcome back to our Sleepy Radiology session and myself Savai here. And today we are with an interesting topic, that is pelvimetry. So before going to the topic, I hope you are all staying in home and enjoying our educative sessions. So today's topic we will be discussing about what is pelvimetry, why it is necessary, and how the measurements are taken in about pelvimetry in our radiology department. So we'll start our session with what is pelvimetry. So what is pelvimetry? Just close your eyes and say it is nothing but measurement and information of the female pelvic brim, and this measurement is done in females just to confirm and say that the female is capable for natural process of birth. That means in that case the patient no need to go any kind of cesarean section. She can follow the normal process of birth unless and until there is any abnormalities. So the main purpose of pelvimetry is nothing but cephalopelvic disproportion to allow the fetus to pass through the birth canal. So you can see here the baby is in the cephalopelvic proportions. As cephalo means head, so you can see here head is connected to the pelvic. So that only we have to confirm with the help of pelvimetry that whether the female pelvic ring is capable for the natural process of birth or not. Next, in our pelvimetric lever anatomy, our P will be working for three reasons. One is passenger. So who is the passenger? The fetus. Next is the pathway. What is the pathway? The birth canal we will look for. Next is what? Power of the lever. That is how much force a female have to apply to contract her uterus for the birth. So all these things collectively we will record in the pelvimetric measurement. Next we move to the anatomical portion. Mainly here we will focus on the bony anatomy. So bony anatomy has two parts. One is the true pelvis, another one is the false pelvis. So true pelvis will be the above area of the pelvic brim and false pelvis will be the below area of the pelvic brim. And in the false pelvic area we also include all the pelvic organs. So here is the pelvic anatomy. So we will consider the bony pelvic only, and mainly we will focus on the front view and the lateral view. So in front view it will be very much helpful to measure some of the diameters. So mainly we will consider the ischial spine area. So you can see here this is the ischial spine area. Next we will consider the anterior superior iliac spines, and I will be demonstrating it very well in the lateral view. So you can see next consideration will be the measurement of the pelvic diameters. So in that case we will measure from the posterior inferior superior spine. Next we require the ischial spine for the mid value. Next we require the ischial tuberosity for the lower portion value, and also we will consider the sacrum and coccyx, both upper portion of the sacrum and lower portion of the coccyx. So next, when you are using the pelvimetry measurement, it should be before the pregnancy, not during the pregnancy. So it should be done to each and every woman to record or to have a trial that whether they are capable for normal regular process of birth or not. And also after the measurement we can also conclude, like during the stages of pregnancy, due to the presence of hormone there will be minimum dilation of the pelvic ring too. So next is what are the modalities best for this measurement. So we can use the X-ray unit. Like before, when there was no such modality CT and MRI, we use the X-ray. And next is we can use the CT MRI nowadays, but we have to use the low kV dose, and this CT we can also give in 3D format, which will be giving us the best result in the view. And also we can consider as a modality like MRI, which can give us informations about the muscle organs as well as entire pelvic ring diameter too. So as well as MRI will be a non-ionization modality, so it will help us in lot more in the pelvimetric measurement. So now we can say that pelvimetry we can use for MRI purpose also, as MRI is not ionizing radiation, so less harmful will be there. But actually pelvimetry is not required for each and every pregnant ladies nowadays, because it's just a trial. You can check it with the help of it. We can just confirm that whether this person is capable for normal process of birth or not. So we can have it, but it is not mandatory for each and every cases. So let's move on to the pelvimetric measurements, how we do the measurements after we have in the system. So first we will do all the front view measurement. The first measurement from top is the transverse pelvic diameter, and in CT you will take the coronal plane. Okay, so what is this diameter? It is just the measurement of the pectoral line and the widest transverse diameter from one point to another point. So you can see here we will, and the normal value for this range is 13 to 14.5. It can exceed but it cannot come below. So if it is 11 to 12 centimeter means what, there is a narrowing, so the baby will not pass from that area. Next, from top we'll just come little down and we will consider the midpoint. So the midpoint of our pelvic ring is the ischial spine. So I have shown you in the anatomical area and you can see here. So next measurement will be our interspinous diameter. So whether the mid passway is correct or not. And what is it? It is the line between the two closest point of the ischial spine. So we'll take from one point of ischial spine to the other point of ischial spine and we will measure it. And what should be its minimum? From 9.5 to 11.5 centimeter. So it can be more, but if it is narrow, again the baby will come from the top level and will stuck in the midpoint, so it will not come out. So that is why measurement is mandatory from each and every steps. So our last measurement in the front view is the intertuberous diameter. So what is intertuberosity? The small two bony projections below in the pelvic cavity. So you can see here in the image, that is the ischial tuberosity. So we'll just measure from one closest point of ischial, that is the extreme point below, from there to the next extreme point, to the closest bony point of ischial tuberosity. So that is the intertuberous diameter. If it crosses, the baby will pass very smoothly outside from the mother's womb, and that is all the measurements we can take in the frontal view. Its normal range will be 10 to 12 centimeter. So now we will go to the measurement for the lateral diameters. So in lateral we have only just two measurement. We'll just move on and we'll see. So now we are going to see both the inlet and outlet measurement. So first we will see the outlet. So that is called as sagittal pelvic outlet diameter, and it is measured from the sacrococcygeal joint. So you can see here, that is the sacrococcygeal joint up to the lower border of the symphysis pubis, and its normal range is 9.5 to 11.5 centimeter. And next we'll measure the inlet, that is called as obstetric conjugate pelvic inlet, and it is measured from sacral promontory, that is the sacral promontory you can see here, up to the superior border of the symphysis pubis, and its range should be within the range of 10 to 12 centimeter. So if you want to do this measurement in CT or in MRI, you have to select the sagittal section, and if you want to do the measuring in the front view, you have to take the coronal section, and for interspinous you have to go with the axial section, because there you have to bring exactly that slice portion. So next we will move to the various types of pelvic rings. So traditionally we have four types of pelvic brims. One is the gynecoid type, the first image from the top. Next we have the android type, below image. Next we have the arthropoid type next to the android one, and lastly we have the platypoid type, which is just next to the gynecoid type. So just we will have a brief discussion. If you are having gynecoid type of pelvis, all the dimensions will be perfect for you, and this will be slightly rounded in shape, and this is the best pelvic brim which will allow the normal process of delivery. Next we have the android type. It will be triangular in shape, and you can see the android type is somewhat heart shape, but this type of pelvis most common in the males only, less 5 to 10% we have in the females, and if it is there we can't go, we have to go with the option of cesarean section. Next is we have the another two types, arthropoid and platypoid. Arthropoid has the elliptical type of pelvic rim, but the main disadvantage is its obstetrical diameter is narrow, so the baby won't pass through it, and that is also not recommended for normal process of delivery. Next we have the platypoid type, where the pelvic brim will be flattened, but it will have the shorter obstetric diameter. Again there will be an obstruction for the baby to pass. So this three types, android, arthropoid and platypoid type of pelvis, are not capable for the normal process of delivery. Okay, and so which is the main capable, which is mainly possible for the normal delivery, sorry, and that will be the gynecoid type. So the name itself is says that gynecoid, that is, I am permitting you for the natural process of delivery. So you can see here, this is the reporting format for our pelvimetric measurement. We can record the values, we can see whether it is in normal range or not, and whether it is permitting for the normal delivery, or what type of pelvic brim it is. So that was all about our pelvimetric explanation. I hope you have enjoyed the session. So please do subscribe and like it and share it to all your friends. Thank you.